Welcome to the Beef Cattle Research Council's webinar on calving and newborn calf management. My name is Tracy Herbert. I'm the Extension Coordinator for the Beef Cattle Research Council, or BCRC, and among other things I moderate and organize the BCRC webinars. This webinar was originally held the evening of December 18th. Unfortunately, despite our best intentions, that session did not record. So what you're about to hear are re-recordings of the original presentations. Here's what you can expect over the next hour. First, you'll hear from Dr. Reynold Bergen, who will spend about 5 minutes explaining the value of industry investments in beef-related research. Then you'll hear from Dr. Claire Windeyer, whose presentation will last for about 40 minutes. And we'll finish by letting you know where to find more information to consider and may be able to take advantage of to benefit your farm or ranch. With that, I'm pleased to introduce Dr. Reynold Bergen, the Science Director at the BCRC. In a nutshell, his job is to talk about science to people in the industry, and talk about our industry to scientists. If you subscribe to Canadian Cattleman magazine, then you've seen a bit of what he does through the research column he writes for every issue.
Good evening, I'm Reynold Bergen. I'm the Science Director with the Beef Cattle Research Council. BCRC is funded by the National Checkoff to fund research that will contribute to the competitiveness and sustainability of Canada's beef industry. The National Checkoff funds us. About 10 to 30 cents of the National Checkoff dollar comes to us to fund research, and the remainder goes to Canada Beef Inc. to support marketing and promotion activities in Canada and around the world. Now, there's a couple of reasons why industry-funded research is of value to you as producers, and one of them is pretty intuitive. Most people understand that improvements in productivity and efficiency often trace back to researchers who have developed better ways or methods of doing things, and those add up and make for a competitive industry. That research progress is slow and incremental, but it adds up over time. And one example is feed efficiency, and feedlot cattle are nearly twice as efficient now as they were over 60 years ago, and that's due to improvements in genetics and feeding and feed processing and growth promotants and other animal health technologies. From day to day we don't see things improving very much, but if you stand on the top of the hill and look back 60 years, you can see that we've come a long way. Another example is forage research, and efforts to fine-tune ways to extend the grazing system have greatly reduced cow wintering costs across the country. But there's other reasons why research has real benefits to producers. And one of them is that as an industry, if we want science-based policy or science-based regulation or science-based trade agreements, we need the science to back it up. And as one example, some research that was done by researchers at Agriculture Canada and Lacombe helped develop cooking recommendations for mechanically tenderized beef. And what this does is it ensures food safety without having to cook mechanically tenderized steaks to a well-done endpoint. So that means you can have a mechanically tenderized steak that's tender and juicy, but also has eliminated the risk of E. coli. So these recommendations are what appeared now on Health Canada's new labels for mechanically tenderized beef. Now, public education and advocacy, and this goes back to the social license issues that are becoming increasingly important. And if we want the public to accept how we raise cattle and beef, they need to know how we do it and why we raise cattle and beef the way we do. And an example of this is the environmental impact of beef. It's often a hot button item, but if people understand that Canada's grasslands are a really, really great way to take carbon dioxide, which is a greenhouse gas, out of the air and stick it in the ground as organic matter in the soil, and that Canada's grasslands provide a home for a lot of plants and insects and birds and wildlife that don't thrive under cultivation, it'll help the public understand that the beef industry has some real environmental positives. Now, if we want Canada's consumers and international consumers to choose Canadian beef over beef from other countries, they need to know what it is that makes our beef better. So we make claims about our food safety system and our beef quality and our environmental performance and our animal health and welfare standards, but we need independent science to back those claims up. And once we get all those claims, we bundle them all together, and those become the Canada Beef Advantage that CBI uses in their domestic and international marketing efforts. Now, finally, to ensure that we keep research going into the future, we need to make sure that we're training and hiring new researchers in a way that they can learn from and eventually take over from our current researchers. It's like succession planning in a business. And the BCRC has been actively involved in training new researchers and getting them hired as well. And one example of this is Dr. Yang, who came over from China as a postdoc. She worked at Agriculture Canada in Lacombe in food safety research, and now she's been hired by Agriculture Canada as a scientist, and she's funded by the BCRC to work with industry and find ways to improve safety in beef packing plants. Dr. Emma McGow is originally from Ireland, but she came over to Canada as a postdoc and is now a new industry-funded chair in sustainable grassland systems at the University of Manitoba. And BCRC is funding her position as well as some of her research projects as well. And finally, Dr. Bill Billigatu originally came from Mongolia, did a Ph.D. in the University of Saskatchewan, went on to do an industry-funded postdoc in Swift Current with Mike Schellenberg, and has now been hired by the University of Saskatchewan as a forage breeder. And so we've got 3 new researchers who industry has funded, who's worked to get them hired, and we're continuing to support them, and so it helps to keep this whole research train chugging along. So tonight you're going to hear from another new researcher, Claire Windeyer, who's originally from Nova Scotia. Now she's at the University of Calgary, and she's been there for a couple of years, and she's going to talk to you tonight about how to keep calves healthy during the calving season.
Hi, and welcome to the BCRC webinar on calves and calving. This was originally presented on December 18th. However, we did have some technical difficulties, so what you're listening to now is a re-recording of that original presentation. They asked me to briefly introduce myself to you, so here I am. I'm Claire Windeyer. I am a professor at the University of Calgary, Faculty of Veterinary Medicine. My area of research focuses on cow-calf epidemiology and health management. So I did want to start by saying that this presentation is a little bit like going to the dentist. Now, hopefully it won't be that painful, but it is sort of similar in that I know every time I go to the dentist that he's going to remind me that I need to floss more often. And for the most part, that reminder does help me do a better job of remembering to do that. So a number of the things I'm going to talk to you about today may be things that you've heard before or that you're already aware of, but maybe you just need that little bit of a reminder or a little bit of a poke to try and make sure that you're really doing some of these best management practices that I'm going to talk about. So hopefully there'll be something for everyone in this presentation. Some of it, you may already know, but hopefully everyone will take home something new from the next, less than an hour. So just to kind of start off with what our goals are, generally in the cow-calf industry, we're aiming to raise the greatest number of healthy calves for the number of cows exposed to a bull with the greatest weaning weights. If you're a seed stock producer, you may have other specific goals for the replacement or the breeding animals that you're selling. But generally, we're all trying to maintain a reasonable cost to production for maximal economic return. And I think it's just important to say this up front so we kind of set the stage for some of the other things that I'm going to talk about in the coming minutes. And so in order to achieve those things, I think it's important to remember some of the principles of health management. So namely, these are things like preventative management. So what can we do to prevent things from becoming a problem before they even start? Making sure that we have a plan for early detection of when things start going wrong, whether that's within an individual or within the herd. and also having a strategy for appropriate intervention, because when these things happen, it's nice to have a game plan already set in place that you can follow. And I think my colleague Tom Pittman said this really well when he stated that routine care and group management procedures for calves have a larger impact on the incidence of disease and death than the absence or presence of infectious agents. So in other words, often these bugs are there, right? They exist on the farm, they exist within the adult animals, but it's how we take care of those calves and how we manage our calving groups that really have an impact on whether or not calves get sick. And so I kind of like to think about this split up into three main components. So calf care, starting with the management of the pregnant cows. And I'm not really going to talk about that today because I think there's other people out there that do a much better job than I can on this topic. But I think it's important to mention that it all really starts way back when we are breeding and managing the cows. And then in terms of calf care, I will talk a fair amount about group management and the impacts that has. And then largely targeting, the topics about individual calf care. And I do want to note that these three things are not listed in order of importance. They're all very important and they all play an important role in calf care. So don't think of them as 1, 2, 3. Think of them as equal players. So some aspects of group management, I'm not going to touch on them all, but just to go over some of them. I think it's always important to consider record keeping, monitoring, and evaluation of these records. I think there's no point in keeping records if you're not going to use them for some decision making. So keeping good records, but then using those records to monitor how is the herd doing, how is our performance, and being sure to evaluate those to see, okay, where are our weaknesses, where can we do more, what are we doing really well, and how have some of the management changes that we potentially implemented played out in terms of our calf performance. This I'll talk about a little bit in a few minutes. So segregation of groups by age and by stage, I'll talk about that in detail. Environmental management, I think this is something probably all of you spend a lot of time dealing with, and much of your day goes into this, but it's always important to remember sort of, that dentist moment, that the way that the environment is managed is really crucial in terms of calf health, and I'll talk about that a little bit more. Disease detection, I'm not so much going to get into this, but it is important as you get into calving season to have a game plan on how you're going to monitor groups to detect calves that are potentially not well, and also how are you going to keep track of the group when are too many calves getting sick that maybe you need to change your action plan. So having those sort of triggers in terms of group level disease detection. Protocol design and implementation. I think it's really important that each producer and each operation work with their veterinarians and with their calving team to ensure that they have good protocols that are designed for their operation individually, and they have a good game plan on how to implement those protocols. In terms of some factors associated with individual calf care, those of you that are calving right now, I know you're dealing with this a lot. Appropriate and timely intervention, obstetrical interventions. So when is it time to get in there to catch the cow, to see what's going on, and to intervene in terms of pulling that calf? And I won't talk about that so much right now, but again, there's lots of really good information out there in terms of how to make sure that you are minimizing the impact of any calving troubles that a cow might be having. Resuscitation, I will talk about this a little bit. Obviously, it doesn't affect all calves, but when it's needed, it's an important issue. Thermoregulation and warming. This is something, well, at least last winter in Alberta, we were having a big issue with. If anyone calved in March, they'll remember the 40 below howling winds. This year, it seems like it's shifted east, and probably those of you in central Canada are the ones that are dealing with this. But it's really important to have a game plan of, how are you going to pick out a calf that needs to get warmed up, and how are you going to go about doing that? Colostrum consumption, I'm going to talk a bunch about that because I think it's really quite important. So the latter part of my presentation today will focus on that. Naval care I won't get into today, but especially if you're bringing animals in through a barn, it is important to have a game plan for that, and I would recommend talking with your veterinarian about products that should potentially be used for that, particularly if you're seeing issues with naval ill in those young calves. Animal identification and record keeping. So obviously your group level records are useless if you don't have individual animals accurately identified and have their records filled out and have good records on each individual. If that's not happening, then your group level records are essentially useless. Disease treatment and follow-up, very important to go back to your protocols, make sure that every calf gets treated, who needs to be treated, and then if that's not working, what is the game plan in terms of follow-up? So if they've been treated, it didn't work, what's your next step? Who are you going to talk to in terms of, when do you call your veterinarian, and those kinds of game plans. So those are just a few of the steps I think that fall under those components of calf care, and we're going to work our way through some of those in more detail. Oh, and also I forgot to mention the segregation of the individual calf. So again, as needed, if you have sick calves, what's the game plan for getting them, if they're potentially shedding pathogens or bacteria or viruses into the environment, what's the game plan for segregating those individuals? So just to start off, we did a calf management survey last year, I guess 2 years ago now, which we circulated between May and December of 2013. We had almost 270 cow-calf producers who responded to the survey, and our average herd size was about 200 cows, but we had a pretty broad spectrum of operation types in our sample, so anywhere from 3 cows to 1,700. So we had a pretty wide gamut. Most of these operations were within Alberta, although we did have a few from other provinces because the survey was available online, so anyone could reply if they wanted to. But largely this was targeted at an Alberta population. So some of the things that we found, I'm going to talk about throughout this presentation, but to start with, we did ask people to estimate how much of their herd they had treated for different diseases. And so the average herd level treatment, so almost 5% of calves treated for scours. Herds, the average was they were treating about 3% of their calves for pneumonia, and just over 1% of calves are being treated for other diseases. Mortality, of course, the highest level being within that first 24 hours. So we define stillbirth as being a full-term calf, either born dead or died within the first 24 hours. So 2.3% was the average herd level mortality or stillbirth. Just over 1% of calves died within that first week of life, and then almost 1.5% of calves dying between 7 days of age and weaning. So I think these numbers aren't bad, but I think there's also some obvious opportunity there to help improve these numbers. And it's important to keep in mind that these are averages. So some herds dealing with a lot more disease and death, and some dealing with quite a bit less. So a lot of the things I'm going to talk about in the coming minutes are ways to kind of keep you on the lower end of these numbers, and also to try and help our industry get these numbers down even more. So some aspects about group management that I'd like to talk about. So in our survey, we did ask people about their calving season. So when did it start and when did it end? And then we calculated out their individual calving season length. And so there was a pretty broad spectrum in terms of the length in days. On average, it was just under 80 days, but it did range anywhere from 16 to 300 days. So quite a lot of variation. So why does it matter? Why is the length of calving season such an important issue? In terms of marketing, of course, it's always nice to have nice uniform groups of calves to sell. So the shorter your calving season, the tighter those calves are going to be in terms of weight when it comes time to wean and sell them. I think a lot of people out there have probably heard people speak about the reproductive benefits to having a tight calving season and how that impacts the reproductive performance of your herd. So I won't get into that necessarily, but if you haven't learned anything about that, I do highly recommend that you go out and try and find some of that information. I think something people don't talk about as much is the labor impacts. And I think we all know that calving season can be a really exhausting time. And the longer that calving season goes on, the more tired people tend to get. And that's when mistakes tend to happen. So really, I think trying to keep it tight trying to keep your calving season tight can have some benefits in terms of the labor and the people that are involved in your calving season. But the two things that I really want to focus on are the exhaustion of the environment and exposure to pathogens that can cause scours. So what do I mean by this? Well, if you think about the first calf that is born in the calving season, that calf is going to be born into an environment that's relatively clean and there's not a ton of pathogens that it's going to be exposed to. However, it's probably going to pick up a few bugs here and there just because they're being shed by the cows or they happen to be in the environment. But calves serve as a nice little amplification vat. And so that first calf, it might get exposed to a few pathogens, but it's going to shed out even more pathogens. So if you're a calf that comes along 90 or 100 days later and there's a whole bunch of calves on the ground, the exposure that you're going to have to pathogens in the environment is going to be much greater than that first calf. And so you're going to get a much larger dose of pathogens, so that those calves born later in a long calving season are at much greater risk of developing scours as that environment gets exhausted by buildup of manure and buildup of pathogens. And so we found with our research that for every additional week that the calving season was extended, there was a 0.03% increase in mortality between 7 days and weaning. And while that might not seem like a huge number, if you got 700 cows, that's a calf. That's one calf for every week. So with calf prices being what they are, that can definitely hurt you at the end of the day. So what are some of the group management practices that you might be able to implement to help optimize calf health in your operation? As I mentioned earlier, environmental management is hugely important, and for a large part that pertains to pasture management when we're talking about cow-calf operations. So many of you are probably already doing this or at least aware of it. But if not, we do try and encourage people to calve on a pasture other than the one where the cows were overwintered, because you want those calves being born onto a clean, fresh pasture with as little contamination as possible. So to do that, we want to move our cows to a calving pasture a couple weeks before the calving season begins. We also want to try and move those pairs out of that pasture into a nursing pasture as soon as possible. And ideally that's within that first day of life and as quickly as possible to, again, make sure that those calves are exposed to as little of those pathogens that might be shed by the mature cows. So things that probably have no impact on the cows but could potentially impact the newborn calves. You want to try and fill those nursery pastures with calves that are as close in age as possible. So that goes back to what I said earlier in terms of exhaustion of the environment and that amplification of pathogens. If calves are close in age, then that limits the amount that's able to happen. So trying to keep those calves close in age in the pasture, in those nursery pastures, can really help reduce the spread of the pathogens associated with, particularly with scours. This is similar to something you may have heard of the Sandhills calving system, where the pregnant cows are moved from pasture every few weeks, leaving the pairs behind. And this just serves for the same kind of function where those newborn calves are having as little exposure to older cows or older calves as possible to try and minimize that spread of pathogens. And so something that, again, you've probably heard of, but maybe warrants emphasizing, is the practice of calving heifers separately. And often this just means calving them before the cow herd, but for some people it may actually also involve separately calving them at a separate location. And so we know that heifers are more likely to have problems at calving and get into issues with dystocia. They may also have problems with mismothering and may have poorer quality or lower quantities of colostrum. And so this means that calves that are born from heifers are often the calves that are at highest risk within a herd. And so if you calve the heifers separately, it benefits the calf as well as the heifer. So we have the opportunity to expose these calves to less in terms of what I've already talked about with pathogen exposure. It also means that we can provide more individual attention to these calves. So they're the first ones on the ground. There's not as many calves and animals to look after, which means you can focus more on these high-risk individuals. Many of you have probably already heard about the reproductive benefits of calving heifers separately or before the rest of your cow herd, but just to kind of reiterate it, when you calve your heifers first, it gives them more time to come round and start cycling again before the next breeding season. So this can have some really great impacts in terms of improving your reproductive management on your herd, as well as benefits for calf health. So a couple other things in terms of group management, ensuring adequate shelter and bedding. I don't think we can overemphasize how important those environmental factors can be. So having deep straw that calves can nestle down in and cover their legs can really help protect them from cold temperatures when you get those really chilly winters, or even just kind of cool, damp spring. Having that deep straw to nestle down in can be worth, some say, up to 5 degrees Celsius. So it really helps protect those calves. Having windbreaks, I think, are of course quite beneficial. Let those calves get themselves protected from some of those cold winter winds. And then also, if you're feeding on the ground, it's important to try and move the site that you feed each day. I think the adage, dilution is the solution to pollution, right? So if you move the feed, that also means that the cows are spreading their manure throughout the pasture, so it helps in terms of fertilization. It also helps in terms of keeping that pasture contamination down. So what about the individual calf care? We asked during our survey, a number of options in terms of what kind of resuscitation techniques people use. And so a lot of people are using the straw and the nose trick, and I'll talk about that in a minute if you're not familiar with it. A lot of people rub calves vigorously. We were quite surprised by the number of people that do hang calves by their hind end, and I'll come back to that one. And just about 10% of people were using the cold water in the ear trick, and I'll talk about that in a moment as well. But I think what was really shocking to us was this majority, really, of people who are still hanging calves by their hind end. And I think really this, to me, is maybe a failure on the part of the veterinary profession, because I went to vet school almost 10 years ago now, and we were taught that this was a no-no. So it kind of surprised me that somewhere along the line this hasn't been passed on to the industry. And so I'll talk a little bit about why this is really important that we start changing this practice. So people have looked at this and they've figured out that hanging calves upside down really does have negative impacts on that calf. And what actually happens is that when you suspend them upside down, their guts, gravity comes into play, their guts press down onto their diaphragm, which actually compresses the lungs, which means that the calves are fighting against additional weight as they try and expand those lungs, making it much harder for them to breathe. And I think this practice came out of the fact that when you hang them upside down, you see all this nice fluid drain out of their mouth and their nose, and you think, oh wow, we're really getting that fluid out of their lungs. But what they figured out is the truth is most of that fluid is coming from the stomach. So you're not actually clearing those lungs, and you're actually making it harder for those calves to breathe. So really want to try and encourage people not to do this. But of course, the question is, well, then what should we do instead? So I would suggest that you want to place those calves upright. And I'll show you, there's the picture. So putting them in what we call this sort of calf recovery position, where both of their lungs have equal opportunity to expand with as least weight on them as possible, right? So they can really breathe in and fill those lungs with air without the guts weighing down on them. And then some of those other techniques that I mentioned earlier in terms of poking the straw in the nose. So not just sort of a wet, soft piece of straw kind of flipping around in the nose, but actually poking that nasal septum of the wall of the nose between the two nostrils. I'm using sort of a pokey piece of straw and pricking that part of the nose will stimulate the calf to gasp. And this is where it's unfortunate that I am sitting in my office and you can't see me, because this is where I usually demonstrate my calf impression. But if you try this out on a calf, you'll see what I mean, that you poke them in the nose and they really will take a nice gasping breath most of the time. Rubbing them vigorously can help stimulate those calves, get the blood flowing, get them going. And then the water in the ear trick that a lot of people maybe aren't as familiar with, squirting or dumping a little bit of water in that ear is sort of like having somebody dump a bucket of water on your head while you're sleeping. It can cause you to kind of gasp and wake up pretty quickly. Now, you don't want to be filling the ear with too much water and causing ear infections, but a little bit of a squirt in the ear really can wake up some of the more dumpy or sort of dull calves when they're born. Some of the other things we asked people about in our survey, we asked them how they checked to make sure that a calf received colostrum from the dam. So a lot of people, making sure that they see the calf sucking, or checking to see if the udder was not full. About half also checking to see if the calf seemed to be full. And then there was a number of other neat techniques that people used, things like making sure checking the calf's muzzle to see if it was warm, looking for shiny teats, or even putting ink on a calf's nose and then checking if that ink showed up on the cow's udder. But 3% of people said they didn't check to see if a calf had received colostrum. And we also had less than 45% of respondents that said that they administered colostrum to their assisted calvings. And I'll talk about these things a bit more in detail. So colostrum, I'm sure all of you know colostrum is important. Our calves are born and they're naive and unprotected, right? So they don't have a mature immune system, nor have they had opportunity to build up their own specific immunity against the pathogens in their environment. And so it's really important that they get that colostrum from their dam or some other source to ensure that they get that what we call passive immunity. So the antibodies that are given to them from their dam, they're really essential to the health and survival of those calves. And not only are the antibodies, what we call IgG, really important, but colostrum also contains important things like calories, minerals and vitamins, and other immune components that are really, really important to getting those calves kick-started. So when we looked at the association with some of those management practices and the health and survival of calves, we found herds that did verify that calves received colostrum by checking the udder, and who intervened with colostrum for assisted calvings had reduced mortality in their herds. So this suggests that these practices may help reduce mortality. So we're doing some research at the University of Calgary looking at the impacts of calving difficulty on calf vigor. And already when we do a preliminary look at this data, we see that calves that are born by a hard pull have reduced suckle reflex at birth, and they're much less likely to drink colostrum on their own within the first 4 hours after birth compared to calves that are unassisted at birth. And so you combine this with all of the previous literature and research that's out there, it's not difficult to see that difficult calvings can have an impact on the health and survival of newborn calves. They're at risk for failed transfer of passive immunity, and also can be at higher risk for chilling and for mismothering, and they definitely represent a lot of extra work and worry for producers that are dealing with them. So I want to spend a bit of time talking a little bit more about colostrum management, and obviously our goal is for calves to be born on their own, no calving difficulty. They get up, they drink their colostrum, and away they go. But that's not always how it happens, and so I just want to focus a little bit on these high-risk calves, particularly those that are born by a hard pull or difficult calving, and some of the things that we can try and do to try and mitigate those impacts and make sure these calves are off to the best start that they possibly can be. So transfer of passive immunity, how do we assess it? We can measure whether or not a calf has had adequate colostrum intake by taking a blood sample after 24 hours of age, but before a week. And the goal is that those calves are going to have greater than 10 grams per liter of IgG in the blood. And how do we achieve that? Well, the calf needs to get 200 grams of IgG within that first day. And that's not to say that this needs to be given by a human being. Ideally, they're going to get it from their cow. We're going to talk about some strategies to try and make sure that that's always going to happen. So just a little bit of background. Cheryl Waldner looked at this a few years ago, and she found that in Alberta and Saskatchewan, 6% of beef calves had failed transfer of passive immunity in the population that they were studying, and over a quarter of them had questionable levels of IgG. She also found in that study that calves that had inadequate IgG in their blood were at increased risk of death by 1.6 times and 1.5 times more likely to have disease. So I think this kind of suggests that this is really an important issue that the beef industry should be paying attention to. And so what does transfer of passive immunity depend on? For one, it depends on how much is available. So largely this is, making sure that you have a good immunization or vaccination program for the cows, and particularly for your heifers. And also this is largely dependent on the nutrition of the cow. So you have to be able, a cow has to be able to respond to the vaccine that it's given. And that means that they have to have adequate levels of energy and protein in their diet to then therefore put those antibodies into their colostrum. And then what I'm really going to focus on is the how much they got. So how much colostrum and how much IgG the calves get. And that is largely influenced by the 5 Qs of colostrum. And I'll go through those here in a moment. So the 5 Qs of colostrum were developed by Sandra Godin, and those are quality, quantity, quickness, squeaky clean, and quantify. I'm going to focus mainly on the first 3, but that quickness factor, I think it can't be overemphasized that calves can only absorb the IgG that's in colostrum during that first day of life, and really that's mostly the first 4 to 6 hours. After that 6 hours, their guts don't absorb that IgG nearly as well. So that first 4 to 6 hours is really crucial for them absorbing those antibodies. The squeaky clean part of it, having a clean cow, clean udder, clean milk, and clean equipment are all really important. If a calf eats a whole bunch of manure on its way to trying to find its cow's udder and latch on, they're going to absorb that manure before they're going to be able to absorb IgG. So that's a big factor that can put those calves at risk. And then the quantify, I'm not really going to get into that, but if you're interested in measuring your colostrum quality or the transfer of passive immunity in your calves, you can talk to your veterinarian about how to. So some more details on colostrum quality. It can vary quite widely. So some of the literature out there that's looked at beef colostrum has shown averages between 110 and 115 grams per liter. But the research that we've done at the University of Calgary, our average was quite a bit higher, 141 grams per liter. But this ranged anywhere from less than 60 to over 200 grams per liter. This compares to what we consider to be good quality colostrum in dairy, which is anything over 50 grams per liter. And the research by people here at the University of Calgary has found in Alberta, on average, about 64 grams per liter of IgG in dairy colostrum. And again, with a wide range, some from below 8 to almost 130 grams per liter. Also, for those of you who are using colostrum products, there can be a wide variation in their IgG content as well. So make sure you read the label and see what amount of IgG is within them, because you may not be getting what you think you're getting. And so I just point this out because there is a large variation, and you don't know if your calf is getting 50 grams per liter or 200 grams per liter. But if you're the calf at the lower end, you definitely are going to need to consume more colostrum to get enough IgG into your system. Also want to point out, if you are using dairy colostrum to supplement when you have calves that are maybe the cow died, or for whatever reason you need some supplementary colostrum and you're getting that from a dairy, odds are the product that you're getting is nowhere near what it is that your beef cows produce normally. So how do we know the quality of the colostrum? Usually in beef, we don't, right? You hope that those calves go out and they drink on their own, and you never even have to see the cow's colostrum. But you may want to check it. It is possible to check it. So if you are giving it to assisted calving, so all the pulled calves, maybe some people do that, where they administer colostrum automatically to those at-risk calves. If you're having problems with neonatal disease or death, you may want to check out your colostrum quality. If you're selecting some colostrum to store in the freezer, which is a good idea to have some as backup, you may want to check the IgG concentration of that. And I would suggest, particularly if you're getting dairy colostrum from a friend, that you may want to be checking the quality of that before giving it to your beef calves. So there are ways to do that, and if you're interested, you can talk to your veterinarian about techniques for measuring colostrum quality. But at the end of the day, really, we're aiming to get that 200 grams of IgG into our calves. So we can kind of come up with some ballpark figures to help us approximate what we need to get into these calves. And so I kind of developed what I call a golden rule. Again, it's really important. I'm not suggesting that this is for every calf. I'm suggesting this is for the calves who either we have our hands on them because they were assisted calving, or if they're at risk for any other reason, whether they're twins or they're particularly weak, they were born in a snowdrift, whatever situation, this is where this kind of comes into play to make sure that calves get enough colostrum. So if they don't suck on their own, I would suggest that beef calves should all get at least a liter of good quality colostrum within 4 to 6 hours of birth, followed by sucking from their dam, hopefully, or another liter before 12 hours after birth. And when I say good quality colostrum, in the beef scenario, I'm talking about hopefully something that's over 100 grams per liter. I wanted to make a quick note about route of administration. So ideally, as I've mentioned, these calves suck from their dam, and that's really the best route of administration of colostrum for all calves. But the second best is for them to drink from a bottle. And the reason this is when calves suckle, it closes the esophageal groove. And so that means that the colostrum goes directly from the esophagus into their true stomach, which is where you want it to be so that it can be broken down and the IgG can be absorbed. When you tube feed, while it's better than nothing, it does mean that the colostrum often ends up in the rumen, and it takes longer for it to get to the place where it can be absorbed. So, if a calf is really weak and it's just not willing to suck from a bottle, or, it's a busy day and you've got other things to do, which is often the case, I would definitely say that tube feeding is better than nothing. But definitely I think it's worth spending the time to get those calves to suckle from their dam, or to drink from a bottle if possible. And so if you're not familiar with tube feeders, again, I'll suggest talking to your veterinarian. It's important to get trained properly on these, and so you're using them appropriately. It's also really important to make sure these things stay clean and aren't passing contamination from one calf to another. And definitely you want a different bottle and tube for colostrum than are used for scouring calves and getting fluids into those, because you definitely don't want to be using the same tube that you tube scouring calves to then go give scours to your newborn calves instead of colostrum. I just want to take one more minute to tell you a little bit about some research out of the University of Guelph recently, and it's all been done in dairy calves, but I think it's interesting nonetheless. Many of you have probably already heard of meloxicam. So it's a non-steroidal anti-inflammatory, so it has anti-inflammatory, pain-relieving, and fever-reducing properties. Other similar drugs that you may have heard of would be Banamine or ketoprofen or Anafen. They're not quite the same thing. They work slightly differently, but they're similar. As far as I know, they haven't been assessed in terms of their impacts for calves for the things that I'm about to talk about. So meloxicam has been approved for use in Canada, and on the label it says a number of things, but some of the particular items that I think are interesting can be used for aiding the improving appetite and weight gains when administered at the onset of diarrhea in calves. I think it's important to note that this has to be in conjunction with fluid therapy. So you don't want to give an NSAID to a dehydrated calf without giving them appropriate fluid therapy while you're at it. It's also labeled for pain relief following disbudding and for calves less than 3 months of age, and so a couple interesting uses for that. But what I want to talk about, it's not published yet, but some interesting work that looked at the impacts of meloxicam at calving. And so calves who received meloxicam following birth had significant improvement in vigor. And so they looked at things like calf suckle reflex and a number of different factors. And these calves were more vigorous when they received meloxicam at birth. They also had improved suckle reflex when they received meloxicam at birth. Other things they looked at, increased milk intake for calves that got meloxicam, and significantly better health scores. So just a little summary, that in dairy calves, that meloxicam NSAID therapy following a difficult birth improved calf vigor, suckling reflex, milk intake, health, and growth. So pretty promising. But in beef, there's no research yet. So we don't really know how well this would work for your hard pulls. I've talked to a number of people who have said that they are using it. It's off-label, but anecdotally it has been shown to be, or people are telling me that it's quite beneficial. And so when I originally made these slides, I said that there's a need for research. We recently got funded to take a look at this. So we will be looking for herds to participate in some research assessing whether or not this is, whether using meloxicam or an NSAID at birth helps those tough pulls, getting them up and going, and also whether that is an economical thing to do. So stay tuned on that one, but I wanted to mention it because I think it is quite promising. So some of the take-home messages from today, just to recap, long calving season can increase the risk of calfhood diseases. As you all know, pasture management is very important to help minimize pathogen exposure. Hopefully, I made this message clear. Never hang calves over gates, but instead put those calves in the recovery position that I showed you. Pulled calves should be monitored closely for colostrum consumption and steps taken to prevent failed transfer of passive immunity. And I gave you a lot of information about that. And then to wrap up, I think, NSAIDs may be beneficial for hard pulls. We still need more information on this, but I think it's quite promising. If you have any questions for me, my email is there. I'd be happy to answer any questions by email, or you can also follow me on Twitter if you're so inclined. So anyways, I guess hopefully this was not as painful as going to the dentist, but maybe a useful reminder on some of the things that you've been thinking about doing, and also hopefully a few new tricks and tips that might help you improve calf health on your operation. Thanks so much for tuning in, and I hope you enjoyed the presentation. We'll take a moment for a shameless plug for our UCVM Beef Cattle Conference that's coming up this June, because Tracy's not here to stop me. So we will be having 2 workshops this year, one on low stress cattle handling and one on dealing with cattle non-responsive to treatment. And that's a 2-part workshop, which includes managing the chronic pen and proper methods for humane euthanasia. And then the conference itself, we're going to cover antimicrobial stewardship, applied animal welfare, and our usual session on hot topics in cattle health. So you can find all the details on our website there at the bottom.
It's Tracy here again. I trust you enjoyed those presentations and found them interesting with some useful advice. There are a couple more important things I want to let you know about before we wrap up. To get more information and science-based production advice through the BCRC, including to find out about future webinars, be sure to sign up to our free email list. Go to our website, www.beefresearch.ca, and click on that subscribe button. If you've got a Twitter, Facebook, or YouTube account, you can connect with us there too. I also encourage you to visit the Canadian Cattlemen's Association website at www.cattle.ca, where you can sign up to their free newsletter called Action News. I also wanted to briefly mention the National Beef Strategy, which was recently released. It promotes a united approach to position the Canadian beef industry for greater profitability, growth, and continued production of a high-quality beef product that is people's top choice around the world. Essentially, it's a solid business plan to set our industry up for success. It's a collaborative effort by the industry's national and provincial organizations and has set measurable goals that the industry would like to achieve by 2020 related to connectivity, productivity, competitiveness, and beef demand. So you'll want to check out beefstrategy.com to see what I'm talking about here. So when you get to the website, the first thing you're going to want to do is watch the 2 short videos. Part 1 is only 4 minutes long and Part 2 is 3 minutes long. They're excellent videos and definitely worth watching. On the website, you'll also find not only the full strategy document, but shorter versions as well. There's a 2-page summary and a 6-page overview that are quicker, easy ways of finding out what this strategy is all about and give you a sense of how it'll guide the organizations in working together towards big benefits, not only for the industry as a whole, but also to you and your farm's profitability. So be sure to check out beefstrategy.com. I'd like to thank Dr. Bergen and Dr. Windeyer for volunteering their time and expertise for this session, and thank you at home for your interest in this recording.